Universitas Negeri Padang, and my student ID is 25018073. This video is about my final project, Besic Listening. I choose the unit 10. It's talk about health and health problems, and I will talk about stroke. So I hope you guys will enjoy my videos. And okay, next. First, we will talk about understanding stroke. Stroke results from a sudden disruption of a blood flow to the brain, and there are two major types of stroke. Ischemic stroke is the one that results from a blood vessel being occluded or plugged by a piece of a blood clot. Another type of stroke resulting from a rupture or a burst blood vessel in the brain, that type of stroke is called hemorrhagic stroke. Stroke brain. Human brain is a very needy organ, and that's why it requires a high blood flow traveling to the brain vessel, and during it, brain cells begin to die. This can happen within minutes from the blood flow disruption. Second, we will talk about stroke risk factor. Stroke is just a tip of an iceberg. It's not a disease in itself. It's a manifestation of an underlying problem in the body. The most common risk factors for stroke are conditions that are well known and highly treated about those are high blood pressure, diabetes, high cholesterol, smoking, excessive alcohol use. One of the most common mistakes people do is they wait for the symptoms of the stroke to go away. In neurology, saying time is brain with every minute passing by, brain cells are dying and causing irreversible damage to the brain. Another common mistake people make is taking an aspirin like they will for a heart attack. In stroke, this is wrong and potentially dangerous because, as we have learned already, not all strokes are created equal. In case you are having hemorrhagic stroke, not an ischemic one, this could be a dangerous and potentially a deadly mistake. Instead, get yourself into the hospital as soon as possible you can. Next, treatment and recovery. Once your stroke is diagnosed and managed in a very early stage, the doctor will formulate a personalized plan for your prevention, treatment, and recovery. You will also likely require physical, occupational, or speech therapy to help you recover after stroke. It is very important for you to stay in touch with your primary care doctor and with your neurologist to help you in your recovery. A stroke in women. Is stroke in women and men are different? The answer is yes and no. No, because stroke is largely depend on the area of the brain that is being affected either by ischemia or by bleeding. So, in the way whether you experience difficulty speaking or paralyzed, men and women experience stroke very similarly. However, women frequently experience stroke in a different action. Women are often stroke primary caretakers to others. They tend to underestimate the severity of their stroke and underreport that even medical professionals underestimate symptoms of stroke in women. This leads to misdiagnosis and worse outcomes after stroke. Stroke in young adults. Stroke in young adults. It's fundamentally unfair to have a stroke when you are young and otherwise known to be healthy. The most common risk factor for stroke in young adults are the usual suspects: high blood pressure, diabetes, high cholesterol, smoking, drug use, infection, including COVID, exposure to OTC, health supplement, energy drinks. Preventing stroke. Preventing stroke is easier than you think. Following decades of research, the American Heart and American Stroke Association professionals developed a simple formula called Life Simple 7. This is a set of measures that they propose to prevent heart diseases and stroke. 1. Stop smoking. Manage blood pressure. Eat better. Control cholesterol. Get active. Reduce blood sugar. And lose weight. So guys, that's all my videos. Thank you for watching. See you.